I'm Dr. John Schaeffer. I'm board certified in internal medicine and infectious diseases and have practiced medicine for over 50 years. I'm here this morning to talk to you about a condition called interstitial cystitis or painful bladder. This is a very debilitating condition for a lot of women. It's a rare condition, but when it occurs, it is associated with not only a lot of pain with urination, frequency, getting up in the middle of the night, but also it's very debilitating for people in social situations where if they're at, a dinner table and have to get up every half hour and go to the bathroom. So let's define the term. Interstitial is just in the anatomy of all the organs. You have cells, and then you have blood vessels, and then in between the cells and the blood vessels, you have a space, and we call this space the interstitial space. So what is interstitial cystitis? Well, anytime we put the term itis on something, tonsillitis, appendicitis, we're adding inflammation. So basically, this is a condition when we do a biopsy, we see a lot of white cells, inflammation in this space in the bladder. Now, what is the cause of this? Well, the cause is unknown. However, we know that part of the pathology is that there is a lining of the bladder wall, a sugar protein that is protective, that prevents the urine from seeping in below the cells lining the bladder into this interstitial space. So we think this is part of the reason why there's inflammation in this area. Now, there are several ways of attacking this condition. There's pelvic physical therapy, where women learn to relax these muscles that are very tense in the pelvic floor. There's medications that can attack the anxiety level because of all the emotional problems that this causes. One of my good friends and associates, Dr. Timothy Hardy, has done some clinical research with a new approach to attacking this condition. And he's using plasma-rich platelets. Now, let's define plasma-rich platelets. Okay, platelets are like plates, and their purpose in the body, their main purpose, is if you have a bleeding area, you need something to block the flow of blood out of that injury. Okay, so these platelets are very sticky. They come along, they stick to the sides of the opening and create this sort of matrix that slows down the bleeding and also allow the clotting factors to now get in there and clot so the bleeding stops, okay? But platelets also have other properties. They have what we call growth factors. So part of the healing of that injury is promoted by the platelets. So what Dr. Hardy is doing is taking the patient's own blood and putting it in a centrifuge and separating out the different components. So the red cells he throws away, the plasma he throws away, and what's left over is some plasma with a lot of platelets. And taking this solution, he infuses it into the patient's bladder and promotes the healing effect, and it's had some very excellent results. Anytime you transplant anything foreign into the body, the immune system is going to react against that. Since it's your own cells, your own platelets, the immune system identifies it as you and does not attack it. So the beauty of this therapy is there are no side effects to have to worry about, since you're using your own body's components. So as an infectious disease doctor, I've seen many patients that have been diagnosed as having a bladder infection, because infections also cause inflammation, and have been misdiagnosed. So if you happen to be a patient where your therapy has not been effective, this may be something that you want to talk to your doctor or Dr. Hardy about, getting a biopsy to make sure you don't have this condition, and then can be approached in a more scientific, deliberate way. The beauty of this therapy is that it can delay the anxiety that's associated with the condition without the side effects of the psychiatric medications that would otherwise be needed. So this would alleviate the need for any use of any anti-anxiety or any antidepressive medications. I might also mention that this platelet-rich plasma is used by other doctors, mainly orthopedic doctors, have used this to inject it into joints to affect healing. So this is a relatively new therapy that Dr. Hardy now is trying in this condition, which is so debilitating, and getting very good results, I might add. Dr. Hardy has been using this therapy now for several years, and on his website you can see many testimonials to the patients that have been markedly helped by this therapy.